We'll get started with the bond referendum health and wellness subcommittee meeting. We'll call it to order by beginning with roll call. Mr. Leanda Javier here. Ms. Bruni has recruited herself or resigned from the position. Pancho is out. Guadalupe Ramirez here. Jorge Gonzalez
Present.
Hector Lanise
Here.
And our liaison, Dr. Chamberlain.
Present.
Excellent. We have quorum. David Vasquez present. We have quorum. Public comments. Do we have any public comments?
We do not have any public comments.
Okay, great. And so we'll move to the approval of minutes from the November 19th Health and Wellness Subcommittee meeting. I need a motion.
Mr. Chair, I did notice there was an error on it. The minutes read Thursday, November 19th, but it was Tuesday, November 19th.
Okay.
So I'd like to make a motion to make that correction. I don't know if there's anything else. I wrote it, so. I don't think there's any other mistakes. I'm pulling your leg to see if y'all would catch it. Motion to approve.
We got a second, so Hector, we got a second. All in favor, discussion? All in favor?
Aye.
Motion carries.
Mr. Chairman, I'd like to move up item 6 if we could.
Okay, very good. Let's go ahead and do that. Can we get a motion to do that? All right,
Second.
all right, discussion? All in favor?
Aye.
All right. Report by Public Health Director on local hospital CEO feedback and any other actions incident thereto.
At the request of the committee, we are very grateful for the presence of our CEO from Laredo Medical Center and from Doctors Hospital of Laredo. And also at the request of the committee, there was a request for Clear Choice to provide some information about their operation. So gentlemen, if you don't mind, I'll just read a brief statement that was sent over to me. Yeah. And then we can definitely get into the discussion from each one of our CEOs. So this message in the committee was copied on this communication sent to Mr. Victor Vasquez from Clear Choice, making the inquiry about the potential of a pediatric unit within their proposed hospital system. His response to that inquiry was, "Thank you for reaching out on behalf of the Health and Wellness Subcommittee. We greatly appreciate the opportunity to engage with the committee regarding the potential implementation of a pediatric unit within our hospital system. Clear Choice is always exploring ways to enhance our services and address healthcare needs of our community. While we do not currently operate a dedicated pediatric unit, we are open to discussing this initiative further. Our team has extensive expertise in various aspects of care delivery and would be happy to share insights that could guide strategic planning for such a vital addition. We are particularly excited about the possibility of contributing to this project and would like to ensure that our potential collaboration aligns with the broader goals of the committee and at the community level. Additionally, I appreciate the invitation to the upcoming committee meeting on Monday, November 25th at 5:30 p.m. at the Laredo Public Health Conference Room. Either I or a representative from our team will make every effort to attend and provide meaningful input. If there are any specific materials or data you'd like us to prepare in advance for an additional meeting, please let us know and we would gladly accommodate. Thank you again for considering Clear Choice as a partner in advancing community health. We look forward to collaborating and exploring this exciting opportunity further." That was Mr. Vasquez's response. And then now we can turn it over to the CEOs for discussion on the topic of pediatric care and within their facilities. Gentlemen?
You ready to go?
I think when we're evaluating, the need for pediatric care, I think we have to kind of look and say, and I think Jorge will also speak a little bit to this, kind of the need that we currently see. And so I think it's good to bring that kind of to this group for their consideration. So I can tell you, our year-to-date pediatric census at Doctors Hospital is about 2.4 patients a day. And so, when you're looking at the needs, and of course, we have limited availability, right? So I guess that's a good preface, right? All we can really take care of right now is just medical patients. So that's basically going to be, fevers, respiratory viruses, things of that nature. We do transfer out patients from all 3 of our sites. The 3 sites being our main ER, our FEDs on Saunders, and then more in the south of Laredo. The total transfers out per month are 16. And so if we were, and those have a wide ranging of complexity. So they need anywhere from support from pediatric neuro, cardiology, critical care, so intensivists. And so if we were to keep all of those at our facility and have the resources, that would make us have an average daily census of about 4 pediatric patients. And so that's really kind of the scale and scope of what we're talking about at Doctors Hospital. And so I think as we look at what solution, and I think I'm certainly not opposed to there being pediatric resources added to the community. I think it's needed. But when we talk about inpatient capacity, whether it be in a hospital or in a unit in an existing facility, I think it's good to know kind of what is the real scope of what we're talking about, and taking that into consideration. Because the resources we're talking about are expensive, they're very costly, and so you have to think about the long-term viability of bringing in those resources that I just described for those patients we send out to be able to keep them here. And what does that look like long-term, not only to the community, but then certainly to the taxpayers that would be ultimately footing the bill for it. So, any questions on that?
Well, let me add to that so we can keep doing it. So, very similar to Andrew, but I'll also point from the workforce standpoint. I think the one thing, I know for a fact Andrew is in a very similar boat as I am. Right now, currently we have only one pediatrician covering call for Laredo Medical Center, 24/7. So that is definitely one of the situations when it comes to coverage, just local pediatrics. The other thing that we gotta also do consider, both of us have NICUs, which are staffed by Driscoll. We both have agreements, and we take care of the neonatal intensive care unit. We do have that. But when it comes to really the other parts of pediatric care, that's the one part that really does concern me. And it's just because we have not been able to attract newer pediatricians to market, except for Dr. Randawa, who joined Dr. China. But besides that, you're talking that there's a lack of pediatricians in this community. The residency program is training these new family residents here, but they're family medicine physicians, they're not pediatricians. Most family practice physicians will not see children under the age of 2 or 3. So, before we start thinking of running, and again, believe me that I think Andrew will say the same, Laredo Medical Center is never gonna stand in front of the public for an increase in pediatric care. We're never gonna do that. But it's important that we're at average daily census of 2.2. It's not feasible to have something like that running all the time. We have a pediatric unit, 29 beds, and less than 6% being utilized for the whole year. So it's transfers, I believe it's the same number. So it's not enough to have all these subspecialties. But the one thing I will say, Driscoll's been an excellent partner to us, to both hospitals. They fly specialists every single day, outpatient, to see a lot of needs here. So for us, really, I think I just want you all to hear that from us. Me or my hospital or our company will never stand in the way of us. If public health is something that they want to do, pursue pediatric care, like infrastructure, that's excellent. That's great for our children. The problem that I see is that we don't even have enough pediatric care to even get to the subspecialty care. As Andrew mentioned, that was costly and something that we just gotta consider for us. But currently, I think if we were to say, I think what we're trying to do here is just support in the way that we can, but we're lack of pediatricians being a huge concern factor for us. I don't know if you want to add anything else, Andrew.
Yeah, I agree. I think if I were to say what is our biggest concern from a pediatric perspective, is the pediatricians in the community. They are. I would say we polled them and looked at the average, and we looked at the average age of specialists and physicians in the community in general. It's actually in the 60s. Pediatricians are probably right there. So there's an aging group of physician resources, and I think the pediatricians to care for the patient community, and then potentially support wherever that unit is in a facility is certainly dire.
Can you all talk about the recruitment process for both your organizations? Just so everybody, I'm a little familiar with it, but if you all can just kind of highlight what the challenges are in terms of recruitment and why you think you're running into challenges to recruit pediatricians or any type of healthcare specialty to the city.
I mean, I think, I've said this many times, I think Laredo, Texas being medically underserved, I think when you look at our needs analysis, you're looking at about 220 physicians that are needed from primary care to specialty care. So sometimes it's that physicians want to have more backup, they feel they need to be part of a group, there's many reasons. I think once we get past the headlines of, or it's word town, or it's this, but Laredo's a great place to live, and that's what my job and Andrew's job is, to be the recruiter in part. People usually get the resumes and we start recruiting, but I think that's the other part of us using an organization like Driscoll, or even anybody from San Antonio, to help us get to the need here. And that is something that really does concern the pediatricians that we have in this community, because, I mean, if you tried to see one, you'd be there probably a significant amount of time, but not because they're working incredibly hard. So, I mean, a lot of the parents are here will tell you that when you go see a PD, they're gonna see you, but it's gonna take some time. And I think it's just the matter of fact of what we have. So, as just, I guess, finish the question, Cash, is for us, as from start to finish, we look at the need, we go look at the candidates, we both offer very good packages, and we try to keep them. The one good thing, we've had great retention from primary care. Pediatricians, we haven't been as successful in just recruiting. The one that we just recruited was because he was the nephew of one of our medical staff. And now what we're trying to do is for him to recruit his friends. Say, hey, it's a great place. But two's not gonna solve the need. We need probably 12. Just, and with imminent retirements, as Andrew was saying, it could even worsen. I don't know if you want to add anything else, Andrew.
Yeah, absolutely. I think both facilities have actually done a fairly good job of recruiting, a specialist, especially adult specialists, to the community. When I look back to when I was first in the community back in 2017, the number of specialists has grown substantially. And certainly when it comes to PCP, the residency program that LMC partnered with a school in San Antonio has certainly helped also supplement that. We don't really have that pipeline yet for pediatrics, and I will just say, kind of from an operational perspective, both Laredo Medical Center and Doctors Hospital, we both have our hospital entity, and then we have our physician management arm. And essentially, with those physicians, we do offer very attractive compensation packages to those physicians. But operationally, I would doubt that there's more than a handful on either side where the practices are even break even. The hospitals subsidize them. And so when you're looking at, and when you're talking about bringing in some pediatric subspecialists to the market, the volume that we just referenced is going to be important, because there will not be the volume to justify full practice. If there was, quite frankly, Driscoll would have already brought it here. And if without that volume to justify those practices, those losses are going to be pretty substantial.
Yeah, the only reason I asked that specific question is because I want everybody to understand that compensation isn't always, because we compensate pretty, we compete with other markets. So there's something else that's there that we just can't put our finger on why we cannot get folks here. So it's not a money factor, it's something else. And so the other part that I like that you brought up was the volume, right? Do we have enough volume to substantiate what it is we're trying to do with this referendum?
Let me chime in real quick, and first of all, I want to thank both of you for coming in today and visiting with us, because this is our third meeting, and we've kind of had quite a few discussions on this topic. And I think it all comes down to supply and demand. I don't think, the population, and I think, correct me if I'm wrong, I don't think our population is big enough to support a pediatric hospital or a pediatric unit. I think you've got what you need. And then, of course, what can be treated here, you know, we've got means and we've got, you know, arrangements with other hospitals out of town where, you know, the transfers will occur. And so one of the things we've talked about is that I don't think Laredo is in a position to grow our population where there's gonna be enough demand to bring in the supply. I mean, if we were to have a pediatric hospital here, we would have, with the number of cases that you've reported to us right now, we wouldn't have too much work for our doctors. And so we have to do what we have, right? And so one of the questions that I think, you know, we have talked about is the relationship that we have with Driscoll right now. The question is it enough, or are there any other opportunities for partnership with anybody outside the Driscoll Hospital?
I mean, I will tell you, I think Eric Hammond and Driscoll have done an incredible job serving Laredo Medical Center. I think just stepping up and helping us staff our NICU to meet our requirements. I mean, the fact that we keep the word level 3 right before you get to the level 4, which is the highest, basically Driscoll, and then all the major metros. We get to keep a lot of babies right here, which again, think about the care that needs to be given and just the level of expertise that we have in nursing. I think that's a great thing that and also all the other specialties. So I think Driscoll, as I mentioned, they fly specialists, they're bringing others here. I think they've done a great job spending those dollars into the community. And just more backtracking to the community part of you were saying, I haven't given this fact, I've never seen it. It's more about you need 1 million people in order for you to be able to sustain a pediatric hospital. That's why the Valley was able to, when you put the whole metro area of the Valley, because you know, I grew up saying the Valley was McAllen, right? And now that's how I grew up. But now that area has bloomed, and there's so many. And that's why they have that pediatric hospital. But I can tell you that, I mean, I haven't heard from Eric, but I mean, I can tell you it's probably a difficult thing to staff that place whenever you have the main hub, Corpus Christi, and he's continuing to recruit. But I think they've been an excellent partner. Children's of San Antonio has, you know, accepted our transfers. I mean, we're very lucky to have CHOSA too. So I mean, we, and University, and Methodist Children's, I mean, there's a lot of places where our children can go. But there's limitations what we have here locally, because as I mentioned, we can't run, and we're not even crawling right now, because what our pediatricians are doing right now is nearly impossible, trying to cover 85 patients in clinic and then try to go see patients in the hospital. So it's very difficult.
Yeah, I think so we keep bringing up Driscoll, I think, kind of just a little bit of clarity on that fact. I think you're right. The upper Rio Grande Valley, that is a little over 1 million population only, with just that McAllen, Edinburgh, Farr, Mission, Weslaco, conglomerate municipalities, about 1 million. The hospital that Driscoll built there, kind of just as a point of reference, you know, it's 119 total beds, but 63 of those are NICU. And so it's really a 56 bed hospital. And so, because theoretically, you know, a pediatric hospital here likely wouldn't do deliveries, and so they wouldn't necessarily have, they wouldn't get the preponderance of the NICU volume. That would probably stay at the hospital that do OB services. And so if you look at a 56 bed hospital for 1 million population, and then scale it down to Laredo, you're looking at a 12, 15 bed hospital, which is probably why it's not sustainable at this point. And it may very well be at some point in the future, right? And I think that may be something we look at. And I think Jorge and I both kind of keep referencing Driscoll because we have the relationship. Not only will they manage our NICUs currently, but also they have the health plan. So it would be interesting, or probably quite frankly challenging competitively to bring another hospital system into a city like Laredo, where the preponderance of our children's health insurance is Driscoll. So you have this competitive factor. If you brought in, say, a CHOSA from San Antonio, they would have difficulty. They may not be in network with Driscoll Children's insurance, and so they might do that specifically, try to steer them to Corpus. So you would create a kind of interesting dynamic if you were to go a different route. So that's why we kind of keep bringing Driscoll as maybe a potentially preferred partner, maybe down the line whenever it's needed. But that's one of the reasons for that.
But they've been great. I mean, for the committee, they've been excellent partners to work with.
Yeah.
Excellent partners to work with.
What is your utilization currently? Are you guys running into any issues in terms of overcapacity? within your respective organizations, hospital beds, do you have enough in terms of, to service this community? And just kind of going back to that point, if we were to add another institution, does that hurt, or does that just, does it hurt or does it help this community? I guess,
Is
in
it
terms of
for
service.
general patients, or are you talking about?
I'm just talking about
pediatrics?
just general altogether, because based on your numbers, I mean, you're seeing 2.4 PD patients a day. I mean, the need isn't there. How long are those stays, would you say on average?
Most pediatrics in general has a lower length of stay than a hospital as a whole. Typically, they're about 2 days.
Same. So, but to answer that, really, I mean, we're not waking up with 30 patients waiting for a bed and overflow. I can tell you that, that's not happening. The other thing that we were able to resolve post-pandemic is that we were able to hire, over 110 nurses. Our retention rate is at an all-time high, less than 8% are leaving our workforce. And right now, we have a 3% vacancy rate, we brought up board meeting, 3% vacancy rate. 3% vacancy rate, that's the lowest it's ever been. So it's not the staff issue is not, we have the possibility to staff to 300 beds, and our average daily census is about 220. So you're talking that we can scale up or scale down the way that we need to. So there's not a lack of beds, I think it's more manpower issue, and that's the residency program. That's one thing that I talked about, but it's in collaboration with everybody. Just for the committee, 17 physicians have stayed in this community, not just at Laredo Medical Center, they're at Doctors Hospital, they're at Gateway, and we are now getting specialists back for adults. But the residency program has been a resounding success for this community, not just that's the one thing that I keep telling people, and we're gonna keep getting more and more, so because they see the opportunity.
Yeah, absolutely. So I think Corey mentioned, an average of since it's about 220 on bed capacity of 300 plus. At Doctors Hospital, we have 183 beds, and our average daily census this month, which has started to be one of the busier months, was 96 patients. So we're half capacity.
Yeah.
And also it sounds like 2/3
Mhm.
down there.
Yeah.
So there's not a shortage of beds in the community.
How long has Driscoll been coming to Lorraine?
I'll say 2017 or 18, so at least 6-7 years. They've been our partners. They always were. I'll say, but they formalized it, especially when the NICU levels were instituted. I think when you were here in 17.
But my point is, if they've been here that long, 7 years, and they would have seen the viability of building a pediatric hospital, they would have already done it.
I would say, I would agree with that. I think it's probably something that, quite frankly, they monitor yearly to see if there's a need, much like we always are looking at strategic planning and trying to grow for the future. I think, and they have, their data is probably a little bit more complex than ours because they do have the Driscoll Health Plan. So they're able to pull and actually see what are the true comorbidities and what's the annual utilization of that pediatric population. So they're going to have a little bit more insight into it. I think to that point, they have brought in numerous specialists. They have clinics kind of all throughout the community, but I don't know of a single full-time specialist that they have here. So if they saw the need for a full-time pediatric cardiologist, general surgeon,
Yeah, cardiology is full-time.
yeah, if they saw the need, they'd have a lot more full-time specialists here to kind of create that foothold before they built a facility, and they haven't done that yet.
My point.
Yeah, that's exactly what I was thinking. So, does anybody have any additional questions for our CEOs? So given the information, I'd like to entertain a motion to see whether we continue to pursue the discussion or even add the pediatric hospital to the bond referendum.
I'll make a motion that we do not,
Do not.
and that we provide an explanation as to why not,
Yeah, I'll second that.
especially when we have our meeting.
We've got a second discussion.
Second.
Alright,
agree, I agree with not pursuing it further, because it just doesn't make sense, economic sense. I mean, there's no way that we can pursue this any further.
Okay.
When we get to 1 million people, we'll look at it again.
Yes.
No, Laredo doesn't count.
As I would say that as you present the why not, provide alternatives as to what's out there.
No, the one thing I do wanna mention is that there is the opportunity for public-private partnership through a 501c3. So before we lay down the no on this discussion, Driscoll is a 501c3. If we were to approach Driscoll and say, we build a facility through this bond referendum, cause that discussion hasn't happened. Would you staff it? Whether at the end, they are in charge of all operation, because the bond does not cover any operation, we know this, right? It only covers the construction, brick and mortar, and then the equipment. If we were to approach them and offer them that solution, then take it back to the bond committee, that discussion, I mean, again, that's just saying hypothetically, we were to approach Driscoll, because they're not the only organization, they're the most involved here in our community, but there's other 501c3 medical operations that would possibly be interested by that. If you tell them I've got a $50 million bond, and I got $50 million to build this facility and buy the equipment, would you operate it? They're in charge of staffing it, they're in charge of manning it and running the day-to-day operations. That's a real possibility. But that discussion hasn't happened.
Mr. Chair, I think we've talked about that, and I think we all came back and we discussed the fact that even if we had the facility, the staffing of it, and the cost of operating it, when you don't have that many patients, what are you gonna do with it? I mean, you're gonna have a facility, a multi-million state-of-the-art facility, that's, everything that's built today is built in those standards. But if you don't have the patients, what are they gonna be doing? And I think we talked about it at one of the other meetings.
Because of the cost of the bed.
But I think more importantly, I think it's important to hear from the two CEOs that we have here and let them guide us, on that response.
And what, Hector, I'm sorry.
I think what David is asking is, if we were able to give you, and I think it's probably gonna be a lot more than $50 million. If the city of Laredo would be able to provide X amount of millions of dollars to build the facility, because a bond referendum can only provide monies for the brick and mortar, not for the maintenance and operations of the facility. But if we could build you a $200 million facility, would you be able to staff it and have it financially even break even at the end of the year? I think, is that the question, David?
Yeah, that's pretty much
That's not 200 million,
You don't have the
1.8
people.
million.
You don't have the people.
a 25-bed facility, $2 million a bed, you're $50 million. If the city was to say, or the Laredo voter says, we're gonna put $50 million in the pot, we're gonna build a facility. Would you be willing to operate it, staff it, man it? Would that be something that, just from your professional opinion, obviously you guys are not your corporate entity, so it wouldn't qualify, but just from with your CEO hat on, given the market, would that be an attractive offer to you if you were able to take it on?
I mean, I'm not speaking for Eric, but I think it's gonna be a lot more expensive than that, I can tell you, because I'm currently in a renovation project that I've blown out our budget, so shout out to my wife in there. But really, I think, it's gonna be a lot more than that, and I think it will take some serious commitment from city and taxpayers in order to be able to pay that. Running a children's hospital is not cheap, so those subspecialties will be very costly, and Eric will be the one to tell you that, or whoever. I mean, Eric, because we have a relationship, both Andrew and myself, but it would be very expensive and probably not the right move. But again, but maybe something else besides a hospital. A healthplex, I know they have one in the valley, right next to one of the UHS facilities. It's huge, and they have a lot of things in there, so maybe it's a step closer to before you get into, or build shelf space. Again, I'm not gonna get in the way, or my company will never get in the way from public health, because that's gonna grow, but I think it's a very costly initiative for whoever comes to sustain that with that low of census. I mean, if we are saying if you combine both facilities, less than 8, that's 2 nurses that will keep it, maybe,
Yeah.
census, I mean, it's small, it's very small. With very high cost specialists, and the way that our payment system comes, especially with Medicaid and others, will be a difficult endeavor.
Yeah, I agree. I don't think they're going to find, so there's, and kind of, I know we keep using this as an example because it's recent and relatively close. The only way that Driscoll would have built that hospital in the Rio Grande Valley is because they built it immediately adjacent to Doctors Hospital of Renaissance. And Doctors Hospital of Renaissance, because they're immediately adjacent, they gave up their NICU beds. Driscoll likely wouldn't, really probably any children's hospital wouldn't take that opportunity unless it was a partner, probably with one of our hospitals, because they want that NICU business, because quite frankly, that's the most economically viable business in pediatrics. And so they would probably want to partner with one of the hospitals in order to take that. So you're looking at, maybe kind of building a children's hospital on one of the other campuses, so that way the cost, there's some economies of scale, because maybe they don't need every radiology modality, right? They can transport their patients over to another hospital. They don't necessarily need a full-blown ER. They will partner. So you have some of those economies of scale that might make it a little bit more viable. And so that would likely be one of the only ways that they would look at that. But they're gonna want the NICU business, which means they're gonna have to be attached to a hospital that can do deliveries, that can do OB.
Gotcha.
And if I were a taxpayer looking at that, I would wanna say, all right, if we're going to do a bond and we're gonna partner and we're going to have our tax dollars, we need to create a memorandum of exactly what we're getting. We're getting these subspecialists, and we're getting, full-time pediatric general, we're getting full-time pediatric orthopedic. I don't wanna know exactly what I was getting for those dollars, those tax dollars.
Any other discussion?
I guess my question, if you had if you had the facility, do you think it'd be more than, because you have 2.2 and 2.4, so it's 4.6 patients a day. I mean, is that, and you think it'll grow once you have it? Do you think you'll have more use?
There might be, so if you were to build a resource, there might be some increase in utilization, right? But it's not gonna multiply 3 or 4 fold. It'll be maybe a 20% increase. When you're starting with a base as low as 4 to 6 patients a day, yeah, it may grow to 7 or 8 patients, but that's still not a viable model.
Yeah, I mean, you might have observations where, like, you come in, you're throwing up throughout the night, you said, I will keep you in the emergency room. I mean, out of the emergency room and into a pediatric bed, but again, an observation patient pays almost nothing, so.
It's based on your million people versus the 300 that we have now, it wouldn't really increase the use of the beds.
Yeah, again, for a million population, Driscoll just built 56 beds, so it kind of uses a ratio.
I just think that based on our discussions, that one would be off the table to the bond committee.
Yes.
We can't, we've discussed in different ways, but the support is not there. The operations of the hospital would not be there, even if we build it right next to one of those.
I agree, that would.
Yes.
Okay. So we'll take it back to the motion, call it. Second. All those in favor?
Aye.
Aye. Okay, motion carries. I also wanna thank the CEOs for their time.
Thank you very much.
Yes.
Andrew, Neto, thank you so much for making the time. I know you guys are extremely busy, so for you guys to be here speaks volumes. And you guys are contributing to really, allowing us to make the right decision as far as this bond committee goes before we go to the public. I know the city really we want everything, right? But like you said, we're not even crawling yet. And before we can do any of that. We gotta get smart, especially when it comes to our tax dollars, so thank you for your feedback. It's really, it was really important today. Thank you.
Thank you. Thank you to the committee for letting us speak. I mean, I can tell you, again, we are, unless your tagline, we are partners in health. So we can continue. I do listen to you. So we can do what's necessary. So, happy Thanksgiving, everybody, and we're not going to be meeting anymore, so. Thanks, appreciate it. Thanks.
Happy Thanksgiving.
Thanks, Richard.
Thank you.
Y'all can exit this way.
Sir.
Okay.
Mr. Vlad, you can exit through this door over here. Yeah.
Okay, sure, we'll go this way. Thanks, I appreciate it. Bye-bye. Thank you all.
That leaves us with Amazon. That leaves us with Amazon.
We're back to number 5, yeah, okay, so, let's continue, follow-up presentation, this is item number 5, follow-up presentation by the Human Resources Director on unfunded liabilities and any other actions incident 2. Hello, Mr. Yancy.
Good evening, everyone. How's everyone? Good. Good. Chairperson and committee, we've been looking at a lot of numbers in the last couple of days. A small committee of Frank, our finance director, and the budget director. And if I may borrow or I guess we can go straight into it.
Yes.
There we go. So what we did as a internal group for the city of Laredo, we've identified that our unfunded liability is $150,868,000. That is a substantial amount. So what we're taking into consideration is the pensions, the fire pension, regular employee pension, and also we are taking what's called an other post-employment employee benefits. So that post-employment is totaling to around $150 million. What does this say? It says that if everyone that works for the city of Laredo left at one time and were paying out their pension and paying out their leave, this is what it's going to cost us. So the back and forth discussions that we have been having is with our bond rating consultant and also with the actuarial consultant that worked on our actuaries from 2 years ago. So we're on year 2. So the recommendation that we've been asked to provide to this committee is to go between $5 million and $25 million. $5 million is the lowest amount that we could probably get started. As you can see, $150 million, and if you're putting $5 million into it, it's going to be a drop in that bucket. It's almost, it almost does nothing. So we asked the question. So the city of Laredo has not created this fund. So there was some discussion by the previous finance director. And the question became, why did we not do it back then? So the business fund that the city of Laredo has is this. It's on a year-by-year funding issue. So on the funding of our medical insurances, on an annual basis, when we go in the budget process, we put in a certain amount into it. So we're putting in there $2.5 million every year to cover the medical part for our retirees. The other part that this committee needs to know, that I would say 95% of that funding goes into fire and police pension. So the city pays their medical contributions. Most of our regular employees, they don't fall into it. And why does the city of Laredo pay fire and police medical? It is because it's part of what's called a collective bargaining agreement, CBA. We're mandated to engage in this back and forth. So we're also talking about developing a 5-year plan on how do we get to the $150 million sitting in an unfunded liability fund or trust some way or another. We told with a couple of numbers, would probably take us, I think it was like 5 years and like $30 million per year to get us to that amount, which is not gonna get us there. So realistically, we do plan on proposing to management, we've been in discussion with management on this as well, modify our current business plan. Is this the wishes of the city of Laredo to move us to the future to modify that plan and change it to where we're at right now? That is to be discussed, and we still haven't gotten a clear answer. We tried to get some information the last couple of days and we haven't been able to clarify that for us. And or also to put a 5-year build-up plan. And we already know that we're $150 million, that's gonna total to about $30 million per year. So where do we get this from? it's gonna either be, we tried going through a bond referendum. Now, what we did learn today, as we were on the phone, right minutes as we're here at this meeting, where our consultant is saying this, he would recommend that we make a recommendation of 25 million. Does not mean, at least we're putting it out to the voters. He says if we put five million, the voters are gonna not take us for real and say, then what are you doing? You're wasting our time. However, if we put 25 up to the voters to consider that 25 million, then they may take us serious and say, well, yeah, we have a problem there. As of yet, we know that our fire pension and our employee pension is gradually moving up into we're not in a bad spot when it comes to the TMRS. And the TMRS, which is fire, police, and regular employees, we're at 85% funding. We're good. Fire, on the other hand, they're at about 60%, which we need to get them to that 70, 80% so we could be comfortable. What this committee also knows, as I said at the last meeting, the city and the fire last collective bargaining, there were some strides. So more employees are going to be hired. We have 91 on the books in the next 2 years. 68 have been approved, and correct me when I'm wrong, Jesus. 68 have been approved. So that young generation is going to feed into that fire pension, which is going to grow that fund. The other thing we're going to do is modify the plan. They're not allowed to do what's called a cherry picking the highest 3 years that you, and build that up on that. And the other thing is that they've changed the retirement age, they've increased it. They used to go down at a very young age, now we're going to increase that year. So there's been some plan modifications. We're not going to see those plan modifications realized until after this year. It's implemented in the last, the actual 22, so we're not going to see the realization of this new plan modifications until coming next year. And then at that time, will give us a real good idea of where we're at health-wise of our pension systems. So that's really what we're going to have to propose to this committee. It's going to be the 5 to 25 million ask to see if we'll go to the bond referendum and see if our voters will approve it. And for the reasons that I've noted, it's 150 million that we need to, that we've identified as unfunded liability.
That's 25 million per year for the next 5 years.
If we put something in, at this point, if we put 5, 12, I was with the 12.5 million, Mr. Esparza disagreed with me, and that's fine. So if we need to start at some point. Mr. Esparza will always tell me no on everything.
He's gotta tighten the purse.
I asked him how much, and he said, no, nothing, and I was like, okay. But the reason he says no, nothing, because the city has been running for over 50 years and we've not put that money. What we do, we plan for it in the fiscal budget year. But the GASB 75, what it does, think of the future. Think of every city, 3,000 employees leave, this is what you're gonna cost us, it's not sitting in the coffers. So we've been able to work that way, but if we as an organization need to change that planning mechanism, then this is a time to do it, and this is gonna be a discussion that this committee will have. And that's pretty much what we're wanting to present to this committee. Mr. Esparza and Frank, do y'all see anything differently?
I think the only thing, Jesus is talking about the budget department. I think the only thing I wanna add to this is in talking to the three actuarials, the OPEB benefit, we're at $150 million. That is our liability out there. It's a little bit different than when we look at the pensions, because the pensions do tell us what that unfunded liability is. The OPEB actuarial tells us what percentage of payroll is the amount that we have out there as a liability. We have 150 million, our payroll is about, based on the actuarials, is about 154 million. So we're about 97% of our payroll. The actuarial did mention that that is not necessarily a cause for an alarm, and that other cities may have 200 to 300% of the percentage of payroll. However, it is something that we're trying to address as the three items constitute the unfunded liabilities that we have. And the bond rating agencies look at that unfunded liability for our rating. So that's why we're trying to strengthen that. So, and that's where we're looking at anywhere from $5 to $25 million. And our consultant is recommending the 25, because that's the one that's gonna have a little bit more of a dent as to where we're gonna put those monies. However, we still need to do some work on this, because we also wanna look at other comparable cities and what they're doing anywhere. So, this is moving along kind of fast, so we're trying to get you as much information as we can to the committee, so that they can make an informed decision if we were to put it in the referendum, or not. One of the key things that we're doing by doing this is that we're showing the intent of addressing that issue. So that is a plus when we look, the bond rating agencies are gonna look at this, because we are discussing it. If we feel, the committee and the city feels that this is a good funding where we're at, then we're doing our due diligence in discussing this unfunded liabilities that we have for the city.
And if I may add, our consultants also recommended, if we do take this to the referendum vote, and it doesn't pass, it may impact the city in a negative way, saying that the voters do not support it. So we're kind of like, should we not? Do we just keep running the way we are? Do we run the risk of we take it to a bond referendum, the voters say no, and then it's gonna impact us in the future when the city does go out for a bond rating request, and then it may say, you know what, y'all gotta know that you may not be strong enough to. So that's kind of where we're at. We're asking the committee, if you all, I know that there's a meeting that on December the 10th, and we're trying to finalize that information. We've been working all this days trying to come in with some better numbers, because I wasn't too comfortable with what Millman provided to us. Our numbers seem to be a little bit off of what our reality is and what they're reporting. So I wanted to get those numbers a little bit tighter, just because we were off on a little, some of the numbers that I don't know if it's at the 150. I'm not saying it with confidence here, just because I feel that I needed to ask more questions of our consultant that worked on our data. So I would like to go back and look at our data. I'd like to see how that calculation came about. The other question that we're asking our consultants and the bond rating companies is, where do you want to see the city of Laredo? They shared with us that the city of Houston, there was another major city that's in Texas. Laredo's no different than the other municipalities. City of Houston was at a 32%, which means that we're at 97 and they're at 32. We're really far off from one another. So the city of Laredo may not be too bad. Not at a point that the bond rating companies are really hounding the city of Laredo. It's more to help us in the future to get a lower rate when the city goes and asks for this. Is mainly what we're wanting to do, is increase that rating in order for us to get a guarantee. We're gonna get guaranteed that we'll probably get that bond if we request it. What we're wanting to do is get a lower rate in order for the city to borrow that money and make sure it's not gonna be at a high rate that practically is happening out there in the market right now. And I think I captured that conversation. Thank you.
I have a couple of questions. So one is, if we're not able to get this, well, let me ask this question first, because it's gonna be important. From my understanding, all the asking, that we're gonna be making, and I'm talking about the referendum, the items, right, like public safety, public health, the public infrastructure, it's just 4 categories, right? Are the bonds gonna be presented for the voters to make a decision in 4 categories, or is it gonna be more than 4 categories?
That is further discussion we're having with bond council on crafting that. It's likely to be those 4 categories, but then it'll be broken down just a little bit more.
Exactly. Kinda like what we went through just this last time,
Right.
when we were talking about, the city charter or whatever.
So all the category doesn't,
And that goes back to, again, making sure that we do a really good job of educating the community of what they're gonna be voting for. Because, there are certain, groups out there who basically have a means to not necessarily educate, but gear the constituents, their constituents or their voters, to say, hey, you know what, just say no to all of those things, because for whatever reason, that's what they want to do, right? And so it's not so much of, providing, the discussion or the educational benefits, it's to what's at the table. It's just vote no, right? And we know who those people are. But it's gonna be important, because there's gonna be some, when you break down all the different asks, and when you break them down correctly, the people are gonna say, okay, I'm good for this, I'm good for that, no, this definitely not. And we also have to remember that each item is gonna increase, our tax dollars, what we have to pay. So that was the first question. The other question I had was, if this referendum for the unfunded liabilities does not go through, has the city in the past ever discussed and proposed to put this item on their budget? And if not, and if this doesn't pass, will they in the future?
No, answer that, and then I have another question.
Okay, it is in the budget. Right now, we are running our operations on the budget itself. Like I just said, 2.5 million every year is
Got it.
funded to this
We just
kind
wanna
of
increase
need
it.
to- Right, what we need to do is because of our bonding actuarials and our bonding company and our actuaries are telling us, we need to be here based on, but when they say here, we haven't gotten an absolute here, where is our here? So this is what I'm digging for, this is the answers that I want, that when I say I want some more time, is because when they're telling us, well, you should be here, but I'm like, well, give me a number, what's my percentage? You know, is a 97 good or is a 132 good? You tell me, and then our pension systems, I already know, my threshold is 80%, industry standard. So my TMRS is at 85, I'm good there. We're working on our fire pension, and that'll take me about a year to 2 years for us to actually see that work come to fruition. So we're moving the right path. Bonding company tells us, well, y'all need to do something. The city of Laredo cannot stay stagnant. If you stay stagnant, your number stays as is, then we're not doing a good enough job. But the city of Laredo has done and taken some measures with our CBAs. We're just about to start police CBAs in this next coming year. We should be able to talk about this. We may need to go back and be realistic with this fire and police and say, look, we can't sustain this forever. Either you're gonna have to put more into it, we're gonna have to lessen your benefit, or we may just have to stop certain benefits. You tell me. We're obligated to take care of our firefighters and police officers. I'm not obligated to take care of your dependents. I don't wanna make it sound so negative about it, but that's our reality. So we don't want to get to the point where we start dropping benefits off. We want to sustain them, and in order for us to sustain, all parties have to buy into this. And this is the message that we're wanting to get. So we still have some unanswered questions within us, you know, and I think the three of us probably asked the right questions, and we haven't been able to get those definite answers from the bond rating company nor our actuarial consultant, which is where my concern is. I mean, I can put in there and tell you 150 million is my unfunded liability, which is crazy numbers if you all look at it. But then I need to say, where do we start? Where does the city's business plan change and say, we need to start this fund? So we've been running without it, so we've been okay so far. But I don't want to put the city in a position that we're going to miss out on not having that fund in order for us to sustain this benefit. And why is it important to the community? In order for us to have a thriving in community, we need to find our most valuable assets, which is our employees. If I don't have my employees to do this job, then we can't provide the services to the community, fire, police, health, you know, we're here. If we don't do this to take care of them, then we can't provide that service. So we need, it kind of goes hand in hand with the brick and mortar part, but we also need our employees here to do that job in order to give us community their services. So this is the importance of why we need to consider doing something at this point. And it presented this opportunity. As I said, we may not need the 25 million like today, but in the event the city finds themselves like, I need 10 million in order to do this, we just had a huge loss of employee lives, then at least we can go back and we can request that bond to cover that $10 or $15 million in the event of an emergency in the future.
If the referendum will pass, so.
What?
If the referendum passes, again, then we have that to pull from, or go in and apply for those bonds.
Yes, no, I think you answered a lot of the questions. A lot of my question, you answered it. So yes, because my question was like the 150, how did we get to that point? How did we get to where we have 150 million unfunded liability?
So I
And how can we improve it without going to the referendum?
So the 150 takes into consideration every single employee with a tenure of career with the city of Laredo moving forward. So every year that one of our employees stays here longer and longer, there's a value behind
There's a
it.
value that
Right.
increases.
Yes, ma'am. Plus the benefits. We have to assume that our medical insurance will continue to increase. We try to keep our insurance where we need to at 10%, so we increase it this year. However, even our medical consultant said we need to go up to 23% above what we're charging our employees. So we're trying to hold that line as much as we can because we're trying to be realistic with our employees and knowing what they can and cannot afford to take home. But so those 150 that you see is moving forward, assuming that those, our ages go up, our benefits go up, and it's kind of staying up together. That's what that 150 means.
Thank you.
Yes, ma'am.
If I can add,
Yes.
Chair, if I can add just, you know, we have been working as it pertains to the fire pension. The city has been working alongside with the union, the fire union, on strengthening their pension plan. Both the city and the firefighters have been increasing either more money into the pension or reducing benefits like, Ms. Anita mentioned, the cherry picking, the overtime, so that I can remember is a 3 to 4 contracts, because the contracts are either 4 or 5 years, we have been making steps in moving. So if you see the history, the funding, with the exception of the previous year, has been going down. As it relates to the OPEB, I think at one point, the liability on the OPEB was 267 on the report that we have.
21.
So there is a trend that that amount is being reducing, and it's at 150. So we are making, even though we don't have that referendum, the city is striving to reduce all the unfunded liability for the 3 entities that were in this statute. And that is built in.
One quick question, because David and I serve on the main referendum committee, and we had we already had our first committee. And in that first committee, public safety, presented. And so, I know that the recommendation that we were given on the last page, on the, what's it called, the CMO, we were given kind of a range of, what each category, really should be looking for as far as the bond referendum, the amount of money, right? And I can tell you that the public safety committee came up with a lot more than what's in here. And if I'm not mistaken, David, I don't remember them, or maybe I forgot. I don't remember them adding this information on their ask either, right? And I don't know why they would not have.
It was all facilities and equipment.
There's just more brick and mortar,
Got it,
equipment,
okay.
and we're on the benefit
Perfect,
side.
okay. And that's the reason that it was left out.
Correct.
Okay, yeah, and so, I was just, wanted to make that point.
So again, if I may, it's assessed, identified, and prioritized, and then once those items get presented to the committee as pushed, you will decide what items are going to be pushed to council at that point.
I wanna go back to the benefits really quickly. So health insurance right now currently, the amount of money that's being pulled into that is 2.5 per year.
This is just for our retirees. The entire health and benefits fund is 39 million.
That's self-funded.
Right, we're self-funded.
That's what you were talking about
right,
the last time.
We're
That's
self-funded in claims and in premiums, that's what we're paying right now.
What's the employee contribution to that?
It depends, we have 3 plans, we have a PPO, HMO, and a CBHP plan.
Okay.
So it depends, and it depends what combinations you have, employee only, employee spouse, employee family,
Yeah.
employee.
How many employees are enrolled in health insurance plans? Got you on that one,
You
didn't I?
did.
Well,
I can-
estimation, would it be
well,
more than
Well,
50%?
no, some can opt out. So we have 3,000 employees, and I'm gonna say that of the 3,000 employees, I have less than 100 that opt out. So a fair, comfortable number that I can tell you, 2,900. 98%, 99% of our employees have the benefit insurance, yes.
Okay. Now, 98% of the employees, given on average, what does that employee contribution look like? What does the city pay and what does the employee pay? That's my question, I guess.
So we have different categories. Fire and police are, of course, are different categories because the city pays 60% of fire and police dependent care. And also depending on if it's employee only and then their family coverage, and I don't have that sheet with me, and I apologize for not having it with
That's
me
fine.
tonight. If you allow me.
If I'm a director of Parks and Recreation,
The director of Parks and Recreation, he's most likely going to have, coverage for himself, $40, and then he has, for employee only, it's $40 if you have a PPO plan. If he has family coverage, they're paying, I don't remember off the top of my head, do you?
but on a
120
percentage, you don't really
something.
need to get into the numbers per se, because, it's not really, it's just really the percentage that the city covers, and then what does the employee pay?
Right, I wanna say that we're at for fire and police, it's a 50-50 pay, and then for the regular employee, I wanna say that the employee's paying 52%, and the city's paying around the 48%. I wanna say that that's the breakdown, depending on the category of the medical plan that they have. So the city does pay for a certain percentage of it, and the employee is responsible for the remaining amount. And I want to say it's gonna be like a 48, 50, 52%, and then on fire and police is 50.
Is that a lion's share of this here,
No.
or that's just something completely different?
Completely
different.
different, yes, sir.
Okay, overtime falls into this?
No,
No, that's something completely different. OT goes to,
the
Right.
salaries and of each department's budget.
It's an operating expense.
okay, so these benefits here, these post-in benefits, what would you categorize them as? If, like, are they just, the pension? Is that where that falls, or is that the best way to categorize these?
Pension.
Without calling them post-employee benefits, just so it's black and white, and we know how to present it to the, John Q. public.
Right, it's pension and medical coverages for the employees that
Health
are
and pension.
post-employed, yes, it's health and pension.
So these are retired employees, that have these benefits after they've been employed with the city.
Yes.
Okay.
Over 22 years, more or less?
Regular employees is 20 years of service, and the age in fire, it's 52 right now, 52, it's 52.
And that equates to $150 million.
So the
It's been
question.
growing over, I'm sure that amount's been growing over the
That's
years.
if everybody
all
right now.
employees were to retire right now.
All 3,000.
3,000 were to-
All.
These are valuations.
Yes, not only, not
This is
all
what we
retired
do
at the
every
same
year.
time.
Right, now
So-
what happens when they do retire?
So again, they're, right now it's at right around 2.5 is what our expenditure is a year. Am I
Yes.
correct?
Same.
Okay.
Of those are retired, so we have about, how many?
We have about 500 that fall in that category up and down, right? So we have about 500, and then once it hits 65, we put them into a different category of medical, which is then they go into a fully insured plan, and it's a lower cost to the city of Laredo because we take them off on claims and we take them off on the regular contributions. So they fall into a different category at that time.
Have you seen any trends in terms of the amount of employees, and I know I kind of go back to this and I ask this question, how many employees or former employees are currently on, or who are receiving benefits?
Retired.
Retired, yes.
Retired fire, police, and regular employees, we're carrying around 500.
So just 500 people would, well,
They're getting benefits right now.
500 people only.
How
On
many,
average,
on a-
well, real quick, and then does that number fluctuate, or has it averaged out
So what?
the last 10 years?
So
Say around 500.
Post-COVID, we had an exodus, that was
Right.
the first one. And then, the year after, the fire pension plan changed, so we had another huge exodus, we hadn't had that many firefighters until one time. And then, right now, it's currently kind of taper off, however, this year, the city's offering what's called a retirement incentive program. So we haven't seen the big numbers that I think some people were thinking were going to happen, or they're gonna wait until January 2025. We're currently right now in that process right now. We've seen less than 10 employees that are leaving. On average, we have between 80 to 125 retirees that leave on a normal basis. I have not seen that huge number leaving for this year, unless they're waiting until come January 2025, and then we'll see more numbers being actualized. But as of right now, I'm not seeing that. We're starting to see some stabilization in that. People are just doing something differently. They're not working for public entities anymore. They're probably doing something differently online, but they're getting away from what we consider our normal work environments. You're starting to see that, and it's impacting us as other employers as well. It's not just a city of Laredo.
Is 500 an average, or has it been going up as far as the number of employees?
500 is an average.
More or less over the previous 5, 10 years?
Right, typically we have about between the 80 to 125 people that retire, and then on average we have about 18 retirees that die on a yearly basis. So once that retiree dies and he's no longer, then it starts cutting back. It's been very consistent. I haven't seen a huge number up on the retirees of recent years, in the last 2 years for sure. But I think we're at a stable point right now.
If I'm not mistaken again, just to simplify things, we're talking about a fund that's required if all of our current people, would retire. This is the amount of money that we need to have in hand to be able to cover all their benefits, right? I think the better question, was we're talking about percentages, we're talking about how many employees. I think the better question is, how much is it costing us on an annual basis to cover this fund? In other words, how much are we paying in benefits for the, current retirees, or 500 employees that we have in the system?
Just on benefits and not including the pensions that they're taking
Right.
home. Just on that, we're running around, if I take everybody, I'm gonna say about $3 to $4 million.
Okay.
Just on that group of employees.
And then that amount of money comes.
What about if you include the pensions?
And if we include the pensions, I need to run those numbers because that's gonna be a high
Yeah,
number.
the pension is a separate entity that we have. One is for TMRS for our regular police officers, and we have a fire pension that pays the pension for the firefighters. The other post-employment benefits, it's any other benefits that they're receiving when they retire. Not that we're paying any of the pension out of this, money, unfunded amount that we have in here. What we're paying out of here is that the public safety, when they retire, they get the medical insurance paid through this side. So that is the amount, the benefit that they're getting is that premium of $700 or $1,200 on a monthly amount times all these people that are retired. So approximately, there's about 2.5 that comes from the operating general fund, because police and fire are general fund, that goes into this annuity where we pay this insurance premium per se. Nothing to do with the claims, because the claims is over on our internal service fund, which is our health and benefits, which pays all the claims, which are in the tune of about $45 million on an annual basis. So this portion is only paying for the premium per se for that medical insurance that the public safety staff are going. There's some regular employees in here that retired under different plans, and one of the plans that Ms. Teniente is talking about is that incentive plan that we did this current year that we're working on. So that's what accumulates. Now, it's not only those 500 people that are in that plan right now, it's also the actuaries look at people coming in the future based on the pool that you have, and people going out of it, people that are pass away. So they have that movement of people coming in, coming out, and that's why they determined that potential liability is out there for about $150 million.
So since they're municipal employees, they don't qualify for Medicare, right?
They do.
Oh, they do for Medicare too?
Oh, okay.
Once
Does the insurance drop when they take Medicare?
Once a retiree gets to Medicare eligible age, what happens, we put them into a full insured plan. It's a supplement to what we already have. So we take them out of our Blue Cross Blue Shield and we put them into a supplemental plan. And that was 100% funded. That one doesn't bother us because their claims don't hit us. So because we're self-insured, a self-funded plan, we're paying everybody's claims. The first $300,000, we pay every first $300,000, and that's what drives our rates. But once that person hits 65, we push them over into that fully insured plan, and then they just stay on that until the life ends.
So
But you
when
pay
they
the premiums.
retire, when an employee retires, they get the retirement and 100% paid of their insurance.
Firefighters and police officers.
And regular employees,
They pay their premiums.
they pay their premiums.
And let me,
Their share of premium,
Yeah,
not
let
their
me-
whole
share
premium.
let me quantify that a little bit. There is amount in one of the collective bargains that does put a little bit of money that goes into that plan to offset. So I will say not 100%, it might be 98%, 97%, but they are contributing into that plan as well.
Hence why our initial assessment of between 5 and 25, but we will come back.
Do you, so, I mean, we have a good range from 5 to 25, I mean, so are you ready today to do the ask for up to 25, or you just wanna stay with the
Or do
range
we
of
wait?
5 to 25 and let us determine
I
that?
would, if I may, I don't know how y'all feel about this, I'm not comfortable yet.
Got it,
I'm not comfortable
So I
for
think
the
we should
fact
wait.
that I think our numbers might be, based on what we see here,
got it,
I'm not sure that they got the right, that they have
I
the right
understand.
data in order for them to give me 150 million. Just by us just doing some quick numbers, we ran numbers and it was like a 204 million, not including the enterprise funds, and that's a scary number because I have people in those funds as well. So I wanted to go back and our consultants, I was
perfect.
drawing down some more questions from them, and we didn't get the answers I wanted. So I'm not comfortable as of today, I am not, unless Mr. Mata and Mr. Spencer.
And that's fine too, I think we've got plenty of time before December 10th meeting, but we definitely do need to find out, do you think another week would be sufficient to get the information? Like if we schedule another meeting for next week, you know,
Right.
I'm in DC next week, so.
well,
It had to be
we still have to
December.
have a meeting, I would imagine, if we can.
December 9th.
Is 150, is that conservative number then?
I think it's very.
Very conservative, so it could be in the 200 plus.
Yes. Yes, I think the numbers were.
And would we go based on that number, on what probability that everyone would retire
I
at the
know.
same time, and we
And
would
that's-
need that amount of money?
I
You
think
know-
that's highly unlikely.
Yes.
I think I think it's highly unlikely in the next 5 to 7 years that all employees are going to say, hey, you know, I'm gonna go pick another career with,
It's highly unlikely.
it's highly unlikely, and so, one of the questions that I see right here on the bullets is to develop a 5-year plan and modify the current business plan. Can you highlight what that means? I mean, the current business plan right now, what is the current business plan? And what is it that you guys are planning on modifying?
The current business plan is that we put this expenditures into our annual budget. So every year that annuity plan is being developed, every year we take a look at what our premium rates are coming in, what our insurance. We work with other consultants, we work with our medical consultants. So based on that, based on our trends, based on utilization, we determine what that rate should be. So that's that's how we run it year by year. For whatever reasons, and we haven't been able to get the answer from our previous director as to why did we not start this then? You know, we've obviously seen this for a while. And the issue is that I don't think that they had enough concern, exactly what this committee has said. No one's gonna leave, everybody's not gonna leave at the same time. But if we're listening to the bond rating companies, they're telling us we should have something in the books in the event that you lose 10 million or 15 million at one time, that we need to come up with that. We need to have it, at least have it in the book somewhere that we can go after that amount. We can make the request, but we don't have to go and get it. That's what they're telling us, secure that we may have something in the future. Modify our current business plan, you know, and this is a management issue that we need to work with management, finance, and budget. Say, is this working for us? Do we need to do something differently? If it's 150 million, how much should we start developing in the next 5, 10 years? When do we want to get to those amounts, and how long will it take us to get there? So that's a discussion we need to have. And or do we need to start a 5-year build-up plan? Do we build up and have money sitting there? You know, I think one of the things that you run across when you build up a little coffer, then you have a different administration that comes in 10 years and says, you know what? Take all that money and we can use it somewhere else to build a facility at some place. So you run that risk, that management plans changes in 5 to 10 years, and then whatever you built up to have as a savings may be depleted in a matter of a budget or two. It's very easy to spend that money. So those are the things that we as an organization, we as a city of Laredo need to go back and talk to management, finance, and budget and say, where do we want to see this city going? You know, where do you see this at? And I can't speak for management because I'm not management, I'm just a little department and working with finance and budgets, just seeing where do we need to be at. So this is kind of the discussions we've been having. My biggest concern is that I just was not comfortable with the numbers that were presented. That's my biggest, and that's about as frank as I can get today.
Well, unless anybody else have anything else, then I'm gonna ask for a motion to table this for our next meeting.
That's all.
That's it.
Okay, okay, probably good. Discussion? All those in favor?
Yeah, I agree with it.
Okay. Aye? Can I get a?
Yeah.
Alright. We'll table for next meeting. Thank you all.
Okay, thank you.
Alright, we're gonna move on to the, I think that's everything, open discussion.
Just real quick, you know, Secretary, who made the motion? Tony made the motion? And
Yeah.
Lupita seconded?
No, we had.
Oh, okay, yeah.
Was there a discussion on having another meeting?
That's actually what I wanted to discuss.
As, if I may, as you put that discussion, just to remind you that, February 14, we need to take, the entire package to council. So we're looking at the, January timeframe is where the main committee needs to grind down.
I think we should meet next week. I know you're out, but that's the reason we have a vice chair. And so, I mean, we need to, we just need, if you have, Ms. Daniela, just let us know how much time you need so that we can go ahead and schedule a meeting today for next week so that we can go ahead and.
I would commonly request to give them more time, because this is a very short business week as well. To
Right,
get to
and I
next
understand that.
Friday, and next Friday would give tomorrow and Wednesday for them to work on it, and
Yeah,
then
'cause
all
quite
next
frankly,
week.
we have a short week, we
Uh-huh.
actually
Yeah.
have 2
So
days.
next Friday.
I agree.
I mean, I'm just throwing that out there for the committee, next Friday, I mean, not.
And
I'm not
because this
telling
is the
you
last,
late.
I think this is the last, issue that we need to vote on.
That, and then I'm gonna let you know, you're gonna have to have one more meeting just to approve the minutes for that meeting that we're having.
Okay, so Friday
So
is
we-
already gonna be
December the
December,
6th.
what's that?
Next Friday, December the 6th.
Correct,
Yeah, and then our meeting is on Tuesday at City Hall for the main referendum.
correct.
Meeting, so, does that mean we would have to schedule a meeting on Monday?
You don't have to approve the minutes from the 6th prior to that meeting on the 10th. We can approve those minutes after that meeting on the 10th, it's just so long that we have the group's consensus on what is going to be presented at that meeting, to then therefore say the Health and Wellness Committee has concluded and it's already put forward to the body.
So, just to clarify things, we are gonna present, we're gonna be ready, are we gonna be ready to present on the 10th, or no?
I know we are on this side of the table, I'm hopeful that we can have that done for you all by next Friday, but that's ultimately, will be pushed to the right.
I will be out of town on Friday the 6th,
Okay.
and I have another commitment, another meeting, on the 9th,
And
on
you will
Monday the
not be
9th.
here next week at all, period?
I'm in DC all week.
Oh, wait, okay, so that's 2 out, so.
I can do the 9th, Monday the 9th, but maybe lunchtime, earlier.
Unless y'all wanna meet on Saturday.
At the 9th, I'm okay on the 9th.
On the 9th, that just really puts us in a bind, because what if we don't have, something comes up, we don't have quorum, and then the next day it's shot, and I don't know, I don't remember, I don't think we have another scheduled date, or I don't know what the other scheduled date is for the main meeting. And, the other thing too is, the more we wait to do the presentation, we're gonna be put on the back end. And, look, honestly, our subcommittees are recommending to city council. City council can look at all the information we're proposing, and they can say, you know what, we're gonna go this way. But we still have to do our very best at presenting to have a shot. And so if we don't, if we wait much more longer than what we need to, and we're not prepared to provide a good presentation on Tuesday, December the 10th, I'm sure the other committees are gonna be presenting. And so public safety's already gone up,
I'm sorry.
and I think they presented and it was approved, it was 360 million, something like that.
Now, the thing is, we're heading into the holidays,
The holiday?
and my time of year, at the end of this month and beginning of next month is getting tough.
So what day are you available?
I'd like to see the 9th, but the 9th, it all depends on if I can move this one appointment that I have in San Antonio. So,
Okay, when are you available?
Okay.
And you're not available on Friday?
On Friday, Saturday, or Sunday.
but you're available on the 9th.
I'm available on the 9th, but during the day, I have a meeting at 5:30.
It gets down to time, so.
Yes, sir.
So,
If I may share, if the committee is ready for the other two items to present on December 10th, which is a meeting with the main committee in line to what you're saying, perhaps the committee can make the recommendation for those first two items, and then a consequent meeting after that, that'll give us an opportunity to discuss it further, and then maybe bring it up on the next meeting in December. That way, you don't lose the opportunity to present those two main items that
The Hamilton project and the public health work.
It's a good idea.
And no, but you're saying meeting in January for,
But we have a meeting on December 10th with the main committee,
with just these items, but then
Yes.
the following item would be the general meeting.
That we don't need to present it on December the
Yeah, we
tenth,
don't
we
have to
can
present
present it
everything.
on a consequential meeting, and that gives us an opportunity to get a little bit more
Gives you more
comfortable.
visibility.
What date is the January meeting?
They haven't said it yet.
Probably the first week.
But at least it gives you a little bit more time in December.
And
And
just to
it
clear those
is,
two
it's
items.
likely to happen on
Gives
the
them
first
more
week,
time.
so that in case we need to bring a second meeting, just so that we're ready for the final, package to city council.
Are we thinking about a May election?
Sorry?
We're thinking about a May election? Yeah.
Dates? Dates? And do you all wanna?
December 9th,
Okay,
during the
so
day.
December 9th at noon?
December 9th at noon, I can make it.
Noon, December 9th? You can?
I'm not sure. I have to
Okay,
check that
tentative.
out.
Yeah, I'm good on
On four, that's four.
December 9th.
And then maybe
I'm good on the
You
ninth.
got more than I'll try to.
Okay.
And that's-
I feel maybe.
Alright, so then I'll entertain a motion for December 9th at 12, our next meeting.
Well, you can't motion to chair.
No, I'm asking for a motion. Okay.
So I second motion.
Hector, second. Discussion?
And just to clarify, it's December 9th
At 12
at noon here at the health department.
Here at the health department.
Okay, and for agenda purposes,
Unfunded liabilities? And any other
and subject discussion.
open discussion?
Are we at 68? You're good right now?
Correct. 58. Sorry, 68.
68.
Correct, yes.
You know, are you good at that stuff?
Okay. So, we're good? So then the motion is?
It's gonna be
December
meeting
9th.
on Monday, December 9th at noon.
Noon here at the Public Health Department. I got, Jorge, Hector second. All those in favor?
Aye.
Aye.
Motion carries. Alright, we're all set and we move to adjourn. Can I get a motion?
So move up. Second.
Second. Alright, all those in favor?
Aye.
Adjournment is 6:51 PM.